Hello, everyone, and welcome to the Young Adult Ministry Mental Health Roundtable. I am the co director for our Young Adult Ministry for Greater Everywhere, Pastor Brian, and I am so excited that you have decided to join us on tonight. So, the one thing I do want you to do before we dive right into this today, please make sure that you share this, that you tag this with anyone that you know who needs to be a part of this conversation. As young adults, we go through a whole lot of stuff, and so it's important that we have the proper resources to help facilitate our journey in this life. All right. So I have with me tonight two guests. My second one is jumping on right now. So give me 1 second. Here we go. Here we
Hello.
go. The team is here. The team is here. So again, guys, make sure that you tag this, that you share this with everyone that you know. All right. So you guys see the names. I want them to introduce themselves first. So we're going to start with Miss Carly Gibson. Miss Gibson, if you could introduce yourself to the people.
Sure. Hello, everyone. My name is Carla Jones Gibson. I am currently a dual certified nurse practitioner, meaning I do primary care services as well as mental health services, and I also do a little bit with our addiction clients as well. I have been in nursing since big swallow, please, 2005. So it has been a long time coming. I've been a peds nurse, OB nurse, and then I transitioned to adults, and I absolutely love it. So my goal is to create a safe space and just help people to understand that it's okay to seek help, and there are resources out there.
Awesome. Awesome. Thank you so much, Carla. And of course, Greater Everywhere. This person is no stranger to us. It's Miss Lakeisha Mosley Davis. Go ahead and introduce yourself as well.
Good evening, everyone. Of course, you see my name. I've been a licensed professional counselor for about 5 years. Been in the mental health field for way longer than that, nonprofit. Um, I am licensed in the state of Louisiana, licensed in the state of Virginia, seeking licensure in the state of Texas, and nationally certified. So that's me in a
Awesome.
nutshell.
Awesome. 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 So listen, the one thing that I wanted to ensure that these ladies give an opportunity to provide any disclosures about the information that's shared today, because at the end of the day, we are certainly assisting via the Holy Spirit and the experience of these ladies, ways to help us grow. But from a legal standpoint, we want to make sure that everyone is clear about what we are doing today. So, Carla, if you have any specific um, statements that you need to make, you can go ahead and do that at this time.
Okay. I will say that although I am a trained healthcare professional, that the content of this roundtable talk is for information and educational purposes only, and that you should first and foremost seek diagnosis and treatment from your personal healthcare provider.
Awesome. Awesome. Anything you want to add, Keisha?
No, I just want to echo what nurse practitioner Carla is saying. I just wanted to come out of my mouth as well. Anything that we're talking about here is for informational purposes, education, advocacy. We're going to be sharing some resources. If you know someone who's needing help, proper referrals. We can provide proper referrals for you through the way of the resource numbers. But please use this forum as information and connectivity to resources in your community.
Awesome. Awesome. All right. So, let's talk about
Excuse me.
the privacy and secrecy of mental health.
Hmm.
I like to call it the generational elephant in the room. For our culture as Black people, we either didn't know what to call it, or we knew something was wrong and didn't want to admit and seek help for you know different quote unquote issues that we may have gotten used to. So can you ladies speak about the importance um, of being able to recognize and speak up about any mental health issue that may be happening in your home, in your family, anything like
I think Lakeisha will agree, and we'll probably piggyback back and
Mm,
forth off of each other's comments because I know I've met her prior to this. It's a
yes,
small world. You just never know. It's just amazing how God orders your steps and allows people to meet and
absolutely.
allows them to come back and forth and cross paths. And I think you have the perfect two guests because I handle the medical component of it and she handles the therapy component of it, and you can't have one without the other. So I
Absolutely.
think we will share some like-minded information, and there'll be some things that she may be able to expand on that I may not, and vice versa. But
that?
as far as the stigma for mental illness, I like to give this scenario, and this is what I talk to my residents and medical students about. And that primary care nurse practitioner comes into play because you can't have one without the other. And what people don't understand is, why is there such a big deal when someone says they're depressed? Why is there such a big deal when they say they have anxiety or schizophrenia or bipolar? You go to the doctor, you get routine lab work, you get a CBC done, you get a
Right,
thyroid done, you get
right.
a lipid panel done. If those levels are off, guess what? The doctor prescribes you medication. So in the mindset of thinking about mental health, yes, there isn't a specific lab that you can draw that says my dopamine or my serotonin, which are different neurotransmitters, of course, that correlate with the different mental illnesses. I'll give you a little sciencey part, but I don't want to get too much into that. But when those things are imbalanced, then that's when you have depression. That's when you have
Mhm,
anxiety. That's when you
Mhm.
have schizophrenia. So if I take a pill to control my blood pressure, if I take a pill to control my diabetes, why can't I get a pill to regulate my mood? It's the
mhm,
same thing. It's an organ just like everything else. Just like your pancreas messes up, you're diabetic. Whether it's heart or kidneys, high blood pressure. Thyroid messes up, you're either hypo or hyper. Same thing. I have a little imbalance of my neurotransmitters. It may cause me a little depression, a little anxiety, a little bipolar, a little schizophrenia. It's a medication or an injection to fix that. You take an injection of insulin. Why can't you take an injection for your schizophrenia? So when I explain it to that, they're like, oh, let's make it make sense. Treat
yeah,
it like you treat everything else. You're
yeah,
not going to stop taking those medicines. So why can't I take my medicines?
yes. And a lot of things, Carla, you could probably attest to this as well. It's the stigma attached to it,
Yeah.
you know.
Mm-hmm.
So I'm glad that you're able to break it down to them, and you're helping me be able to take that lingo back to my clients as well. That it's from a medical standpoint. It's seen just as though you're taking something prescribed you for life. Your mental health is your life. It is your physical life. And the
Mm-hmm.
stigma is, uh, well, I don't want to look like I'm crazy, or I want to try to do this on my own.
Mm-hmm.
And so the
Or
education,
God's gonna deliver me.
God's gonna deliver.
See, you jumping too early, Carla. We gonna talk about this. I promise we are.
And I'm glad that we can laugh about it because
Mhm.
you heard, because in therapy, we try to get our clients to hear
Mhm.
the back part of that. God's gonna help me. God sent us, you're getting help. So
Come
we
on.
heard the problems
Absolutely.
right
Mhm.
then in it.
Absolutely.
Mhm. Mhm.
Absolutely. And just with Carla, I like how you align mental health with any other physical condition because a lot of times we struggle going to the doctor for our physical body
Right.
because sometimes I think we're ashamed. Sometimes we
Mhm.
may not really want to admit that things are wrong. And although like
Mhm.
I'm feeling, like I know something's wrong,
Mhm.
but sometimes getting the prognosis from a doctor sounds finite and it sounds
Mhm.
like I'll never ever be able to recover from that. And
Right.
so we attach that same thought process to our mental health.
Mhm.
And like Lakeisha said, there's a for whatever reason, we have a reputation of how we
Yes.
think people view us. And it's
Right,
not
Mhm.
even really the case because a lot of people
right,
don't be thinking about us the way we think people be
right.
thinking about us, right?
Right.
Um, so I
And it's
really,
largely how we see ourselves when to cut through
absolutely,
all of that. It's how we see
Mhm.
ourselves. And it's something I had to break through and
Yeah.
understand when I
Mhm.
was going through licensure. There's a book called The Wounded Healer. So you got to first, as helping professionals, we have to first deal with our own wounds and
Mhm.
our
Mhm.
own traumas, whether it's workplace trauma, home trauma, childhood
Mhm.
trauma, to be able to help someone else. So if you can help that person see that these your perspective of how you see yourself can also be projected, that you think people are seeing you that way.
Yes, ma'am.
Having open conversations about what you're thinking. So when they say that to me, that I don't want to be seen this way, my
Yes.
response is, well, how do you see yourself? Do you see
Mhm.
yourself staying
Mm.
in this situation? And no
Mhm.
one's got to know. No one's
Right.
telling knows what medication you're taking unless you
Right.
tell them.
Right. And
Absolutely.
even with that being said too, in the black community, not only black males, they don't want to come in because they don't want the medications. They feel like they're okay. And they're raised, you're a man, you suck it up and you deal with it. You
Mm-hmm.
don't cry, you don't show emotions, and you just do what you need to do. And then as women, we're told you do it all. You be mama, you be sister, you be brother, and we wear all these hats, but we're not taking care of our mental health. And we may feel
Absolutely.
down and we think, oh, I'm just tired from ripping and running. No, that could be a sign of depression. Or I
Right,
just get anxious because I can't get everything done. That may not necessarily just be because you have so many things to do. It could be an anxiety, but we
right,
Right.
blow things off because we feel like we were raised to just do it. Grandma did it, so we're supposed to do it. And, grandpa was just a little crazy. No, grandpa probably has schizophrenia and needed an injection.
Right.
So we have to break that barrier and just know it's okay to seek treatment, and we don't have to wear the weight of the world on our shoulders and
right.
not seek help when we need it.
And suffering in silence,
Yes.
Mhm.
not being
Mhm.
able to really talk to someone about how you
Mhm.
really feel. And I try to tell them, because we're in the medication portion of this, it's
Mhm.
not forever, and
Yes.
it's a helpful moment in it can be helpful to a moment of time in your life. It's not a life of taking medications, and it's a part of it. So while you're trying to even stable off to not be so emotional all the time, or not be so moody up and down, or like Carla said, depressed, the medication can help you stable off so that you can think about the issues that you need to work out. Because often you can't think about something if you're not able to even get out of bed, or to depression. There's an old commercial, it says depression hurts. It hurts.
Mhm.
I've
Right.
experienced it. I have
Mhm.
repeat lapses with depression in it. It's easy for me to share that now, but 5, 6, 7 years ago, that was not easy, for me
Right.
to share.
Yeah.
But that's, appropriate self disclosure here. But talking to someone and being able to say that allows you to get the help that you need and not suffer in silence.
Yeah.
And people, you have commitments that you're trying to make, family, work. You're not able to make them, and people think, well, they don't care. They're just, not checked into life, but it's really
Mhm.
something that they're struggling with. So you
Yeah.
can
Right.
get an understanding by shedding light on that.
And on the flip side of that, too, as healthcare providers, we know we provide the resources. We know that we provide compassionate care. But on the flip side of that, you have some people that feel like I go talk to my primary care and my needs aren't being met, or they're
Mm,
not listening, or they're telling me, oh, that's just a little stress. Oh, that's just life, and blowing off my signs and symptoms of depression or anxiety. So on the flip side, I want to tell everyone too, you have to be proactive about your care. If you're not
Mm.
getting what you need from your provider, demand that they give you what you need,
absolutely.
or you move around until you find someone who will listen. Because you do
Absolutely.
have that opposite side of
Yeah.
why people don't seek care, because they don't feel like they're being heard. And I hear that a lot too, as far as postpartum depression in
Mhm.
Black females, that they're just said, that's just the hustle and bustle of adjusting to becoming a mother. No,
Mhm.
postpartum depression is real. So if you feel like you're not being heard by your provider, I encourage you, seek and move around until you find someone who will listen and take you seriously. This is your life and you know your body.
Yeah. And some of the
Yeah.
clients will say, well, the provider, they're not listening. They're just throwing medication at me.
Mhm.
And I don't think that's true. I think that
Mhm.
sometimes the clients will, or people, I don't like the word clients, people, when on the flip side, like Carla's saying, if they're seeking medication, a quick fix, medication is
Mhm.
not a quick fix. There are, of
Mhm.
course, personal choices, personal decision. There's work that goes into maintaining your mental health and being healthy. There's work into that.
Mhm. You know, we've been, um, anybody that's a part of Greater has heard a principle that Bishop Grant has been teaching us for years. And he says, you will not conquer what you won't
Hmm.
confront.
Hmm.
And you won't
Mm.
confront anything that you won't
That you will
confess,
confess. Hmm.
Mm.
right? So
It's
it
deep.
begins by
Mhm.
us confessing, I need help. And you guys have mentioned some really, really great, suggestions and instructions onto the ways to get rid of the stigma, or ways to understand that it's okay to not be okay. Like, it's
Hmm.
okay not
Right.
to, as Carla mentioned, feel like you have to have the weight of the world on your shoulder. Like, weight isn't attractive. It's not like
Mhm.
being strong. You don't have to be strong all the time. And I
Absolutely.
think we've been taught that, in both male and female. Like, we've been
Hmm.
taught that strength is what's necessary
Right.
in order for you to live a healthy life.
Mhm.
And just not it's not the case. It's not the case at all.
One of the
Um,
better words could
yeah,
be
go ahead. Yeah.
determination, strong will, not quitting, surviving. There's something, I think, Carla, you probably could speak to this too. The last year or so, we've seen there's probably a hashtag or a phrase where, we as Black women and then probably other races too,
Mhm.
saying, I'm tired of being a strong person. Soft
Yes.
girl me.
Yeah.
Hashtag soft girl me.
Mhm.
Yeah.
And I've been married for 3 years now, and my husband has really helped me get back to the true part of soft girl me. And it took
Mhm.
me to really learn to be vulnerable and trust the people that are around me, to understand that they're not taking advantage if you show your vulnerability. So it takes
Right.
a large part of yourself to say, I'm going to go be vulnerable with my healthcare professionals and my therapist. But if you're going to go, because sometimes, Carla, you'll see this, people will come and they will sit in front of you and will not talk about the issue. They'll
Right.
have problems, and even regular medical, they'll have issues
Yes.
and not tell the doctor what's wrong.
Mhm.
You have to say what's wrong. Now, me as a therapist, I'm going to dig, but sometimes I get tired.
Mhm.
And one of my favorite phrases, is to say, well, let's go back to the beginning. What really brought you here? Are
You're
we
here.
talking about that?
Mhm.
What's really going on? And then if I have a good relationship with them, I will probably say, are we really talking about what's the problem? What's going on?
Mhm. That's what I do. I
We're
tell
on
them
the
I call,
clock,
I tell
you
'em I
know.
call my card. Mm-mm, that's not true. And back to what Pastor Brown, you were saying, I just did a series of talks about it's okay to not be okay.
Yeah.
It's okay to wake up and say, you know what, today is not my best. And that's okay. We don't always have to have it together. I said we put on so many different masks and we just hide how we feeling. But it's okay to take a day and say, I'm not okay today. And then
Yeah.
even I piggyback onto that. And I always tell when I end my sessions, you cannot pour from an empty cup. Sometimes you have to take a time to refill, replenish, and refresh yourself. I can't pour into you if I have nothing left to pour. So
That's
you
right.
have to take that time to take care of yourself. If your mental health is not in check, your physical health is going to start to decline and vice versa.
Absolutely.
Absolutely.
Totally
Absolutely.
agree.
Mhm.
So, I'm going to take this moment again to ensure that, everyone, you can find us on Facebook, on our Greater Everywhere Facebook page, and on our YouTube as well. If you're on Facebook right now, please make sure that you are tagging someone who is, in need of some of the information and the encouragement that we are speaking of on tonight. All right. So, let's transition a little bit And let's talk about, since we are speaking from a church page, let's talk about the necessity for Jesus and therapy. Um, those of us in the church world, for many decades, we've relied solely on on the Holy Spirit and solely on the Lord to fix all of our issues. Um, you've heard it talked about from the pulpit that all you need is Jesus, right? And um, it's not a lie, it's just incomplete.
Hmm.
Right.
And the reason I say that it's incomplete is because your pastor, your preacher, and it really goes back, Carla, to what you said earlier, but your pastor and your preacher can't fix your broken leg. You
Mhm.
don't go to your pastor when you break your leg,
Right.
you go to a doctor, right? But
Right.
yet, a lot of times, and coming from a preacher, pastor point of view, a lot of times our church environments, we as preachers and pastors took on the responsibility of being everything to people, and we were operating in areas that we had no business operating in because we just didn't have a skill in that area. as
Hmm.
much as as much as I love the Lord, as much as I read the word, as much as the Lord gives me insight, there is still some things that I should not make recommendations, and I should be wise enough to say, okay, so you have a substance abuse problem, and I can help you put boundaries in place, but the addiction part of it,
Hmm.
you may need some extra help. You may
Hmm.
need someone who is qualified to address that. So in your experiences, have how have you been able to encourage those in the body of Christ to seek assistance, when they're more comfortable praying about
Hmm.
Well, I will tell you, and then I'll let Lakeisha expand on, and we'll go back and forth.
Sure.
But in my experiences, I tell them, and like you were saying with your broken leg, I say when you have issues and you need glasses, you're going to go to the eye doctor to get that prescription for your glasses.
it? Right.
When you have something going on where you may think you have an abscess or a cavity, you're going to go to a dentist to get them to work on your teeth. So the same, it goes for that. I understand that I have some that say, oh, God's going to deliver me, but also God gives you wisdom to know all of these different things are set in place because of him. I am who I am because the gift that he's given me. So if he gives you, wisdom enough to know it's time to go to a doctor about this and seek this, and that goes the same for mental health. We're there for a reason. We're a resource that God has gifted us with. I'm who I am because of what he's given me. So use me. I allow him to
Yeah.
use. I'm being used by him to heal you. And so I
Mhm.
just give them that scenario. And even when we talk about our addiction clients, yes, they're like, I'm going to pray and God's going to deliver me and I'm going to have deliverance. Yes, but when you work those steps, there are things that you have to do and resources out there that are God given resources for you to utilize. And yes, we want you to pray in the process to help continue to keep you where you need to be. So you need a combination of both.
Hmm.
Mhm.
So I
Yeah.
was trying to take a couple of notes because it's so many things that we could say there.
Yes,
And
yes.
if I may come back to it, but the first thing is I wanted to just share my experience. I
Mhm.
worked for Brentwood Hospital in the
Mhm.
addiction residential treatment, partial hospitalization program for several months prior to and
Mhm.
leading through COVID. And just recently, they actually called me to try to come back. I don't know about that, but because there is a great need still with
Yes, there
addiction,
is.
and there's a great need for if there's clergy, if there's licensed, and then there's
Mhm.
unlicensed. What we see on the internet today, and it was something I was reading earlier, and it kind of spanned out of COVID. A lot of people with no certification, untrained, excuse me, but they do have a heart to help. there's a space for everyone. There's a
Right.
space for it. And then, like Brian said, there's a knowing your limitations,
Mhm.
um, and what you have been trained to do. So one of the reasons I was going into the school with Greater, our program called Project Elevate, we were going into the schools prior to COVID. We were working with a lot of kids that have behavior issues. I was untrained. I was unaware of the factors that happened at home, in our poorer schools. And so I felt out of place, but I had a heart to help. So what I
Mhm.
decided to do, I went to school, the whole master's program, didn't skip one beat, the entire master's program, the entire 3,000 hours of training, the entire licensure process to be able to diagnose and to treat people. That doesn't mean that there's not help in the church because someone is not clergy or they're
Right.
not licensed. What it means is know your place and know your role, know where you can, what can help you and what the limitation of the place where you are. Church, for me, there's no limitations. It's all there.
Mhm.
So if you have the access, someone's more comfortable with praying, but there's
Right.
action behind every prayer. So
Yes.
when you are prayed for and when you are lifted up and when you get off the floor, you got to put some
Mhm.
action and some
Right.
change. That's when you go seek your licensed person.
Mhm.
Then you seek your peer support. Then you seek your friend circle. Then you seek those strategies. There's a family. There's a whole treatment team process to be serious about overcoming addiction. But there's only one person that can do it completely
Right.
and wholly.
Come on,
There's
Keisha.
only one. So I
Mhm.
would
Yes.
never say it can't. Praying is above and be above all of us that
Yeah.
are licensed
Mhm.
and thinking, we have that power. That power is given to us.
Yeah.
So
Right.
when you go talk about AA, Alcoholic Anonymous, and the
Mhm.
Big Book, there's a place that it's driven out of scriptures and principles.
Right.
So for someone that um, sees that as their higher power, as they say, use
Mhm.
your higher power. In fact, I probably go into more spirituality in my sessions than I probably should be. But if my clients say, I
Mhm.
want to pray in the session, we're praying.
Right.
If
Yeah.
my clients say, I'm trying to get back into the church, let me help you figure out a way to get there,
Mhm.
overcome. So then that was another point, the obstacles in the church. And I think, Brian, you had a post the other day and it went off Instagram before I could finish listening to it about just that, the
Yeah.
obstacles in the church, but the church
Mhm.
can help you. And then I've also seen someone don't do any, well, not with God. I've
Mhm.
seen them just 20 plus years alcoholic, the town drunk, the town um what's the word that, not the town drunk, but the falling out drunk, whatever it's
Mhm.
called,
Mhm.
completely changed.
Mhm.
But there was a spiritual lifting there. There was
Yes.
a cleansing, there was an exorcism. And
Mhm.
and I speak of this because I was a little girl and I don't want to it's a family member, but it's not the family member my family is watching, it's not the one y'all thinking of. But I lived through that where he said, I see three demons in the room. And my mom said, we're about to leave this house. But it wasn't an easy process. It was a scary process for
Yeah.
us as a child.
Mhm.
But the process that he went through to have his soul body cleansed of what was, if you're a spiritual, from a spiritual standpoint as I am, see it as, you know um, symptomatic, yes, of our physical symptoms, but also a spiritual sickness. So if
Yeah.
Mhm.
there's spiritual sickness inside of you, you must have someone that is trained in that area.
Right.
So I just feel like there's a place for everybody. And this is just my soapbox.
Mhm.
Brian, you don't
Mhm.
probably hear me talk like this all the time.
It's all good. This is why you're here.
But it's
Wow.
true. We have an addiction counselor, and when we sit and have our talks with our clients, she will tell them, I'm going to cover you while you are recovering. And a lot of them don't get it. She tells them that in the very beginning of their treatment. And some of them have not a clue what she is saying, but I do. But when we make it to the end, they understand completely. And you'd be surprised how many of them leave out with a better understanding and a better relationship with God than they had prior to starting. But I love her when she says that, let me cover you while you are recovering. That's deep.
Absolutely.
Yeah. You know, I like how you really talked about the healing process from a faith point of view. Because again, I've been a church kid since I was 5.
Mhm.
Hmm.
So to me, and again, I think this may have been just the way I was taught, I thought all healing was instant, right? Because you go to the altar, they lay your hands on you, I'm
Right.
healed, right?
Right.
Mhm.
But over the years, I've
Mhm.
realized that not all healing is instant. Like there's some instructions that even after you see the preacher or go to God in prayer, there are some additional things that you have to do. There's a story in I think First or Second Kings about Hezekiah. Hezekiah is a king, and he comes down with this really bad sickness, and so he goes to the wall and he prays, and the prophet comes and says, "Okay, I heard your prayer. You are healed." But he gave him instructions to do specific tasks for 3 weeks.
Hmm.
And so, although he met with the prophet
Mhm.
declared that he was healed, there was still an additional process, some additional steps that he had to take in order to realize and to see that healing all the way through. So when it comes to the the church, when it comes to Jesus, when it comes to therapy, we cannot be so heavenly minded and so
Mhm.
focused on the word and so focused on Jesus that we forget to do the practical thing, the wisdom that God gives us.
Right.
Because I believe that it is the practical instructions that keeps us from being bound by those things long term, right? Because I know, especially from an addiction standpoint,
Mhm.
most addictions um, don't aren't fixed instantly. Some
Mhm.
are,
Hmm.
like Keisha said, some are, but the majority of them, there's a process that has to be
Right.
followed. And so, anyone who is watching, who is who believes in God and who um, is confused about the prayers that you pray to God about a specific addiction or a specific issue, whatever it is, and you believe you pray to God and it doesn't seem like anything is getting better. I believe if you go back and you ask the Lord, what is it that you want me to do? And how can I follow your way and your will to help me get complete healing? The Lord is going to point you in a direction, point you to someone who can give you that practical wisdom. Because, like I mentioned earlier, we cannot allow um, those who preach and teach the word, we can't put too much on our plate, especially in
Right.
2023,
Right.
because there is an entire liability thing now that if you give advice to
Hmm.
someone
Mhm.
outside of your scope of
Yes.
Hmm.
influence, you can mess up a lot of
Mhm.
stuff.
And a
I
lot of lives, a lot of lives. And I was
right.
kind of getting that to earlier, but I didn't want to get a little too ahead of
Yeah.
of ourselves. One of the reasons why I did go back to become licensed, fully licensed, is because I wanted to make sure that I did receive the training. I do know, and I do believe that, you know, there are areas, like I said before, where you can help and you don't have to, have that just because you're not licensed doesn't mean that you don't have knowledge or wisdom to share.
Right.
Right.
But
Yeah.
when
Good.
you start talking to children and you start talking to individuals who are suicidal and elderly who are having a hard time, in the nursing homes, and just people with general, mental health issues. There are boundaries for us. There are things that we should not, pressure someone else to take on our beliefs. We have ethics. We have rules that we abide by, and that we're governed by, and we have boards that we have to answer to. You don't want to, everybody out there just doing something, and there's no principle. Now, I'm not speaking of the theories in the books. I'm speaking about mind, body, and soul guidance to know that when someone's listening to you, they're really grabbing hold of what you're saying.
Right.
And if you tell them something, sometimes they'll come to therapy and they really want straight up direction. Please tell me what
Right.
to do.
Yeah.
So we're advised not to, you could be a therapist that is in advice giving. I don't engage in advice giving. I have suggestions. I have, decision making processes, what works best for you, but it can really leave you up to strong liability. We have that malpractice insurance, which you can't really get. You can't get unless you're licensed. To help you make sure that what you're saying, you understand that the person that's listening to you is really absorbing it. I have clients that say, help me, I don't know what to do. And the mere word, they'll say, oh, I never thought about that. Maybe it's that. And you're like, no, that's not what I'm saying. We're talking about it. So the power and influence of psychology into someone's mind is so powerful. You want to make sure that your therapist, your nurse practitioner, even your doctors need to check and see if they are currently licensed, because there's people out there that practice that are not. You want to check some references. You want to make sure that you get to know them. And I'm not speaking down about anyone. It's just a matter of fact that people do practice without licenses. And you want to make sure that they have your best interest in mind and not trying to fulfill something within themselves to be in a higher capacity. So I always tell my clients, there's no difference between you and I. I just have a license to help.
Right.
We can switch sides at any time.
Oh,
when I could go on.
Right. No. I wanted to add to you when you said that about, you're no different than I am. I just have a license. And I tell my clients, I'm on this side of the table, but I'm only one situation, one financial crisis, one health issue, one stressor from being on the other side of the table. And that's why I can sit and talk to you and truly listen to you, because I know at the blink of an eye, I can go from being provider to being a patient.
Absolutely.
And when you give that, you develop that level of rapport where they're open and they're comfortable. So if we have any healthcare providers that are on, be that person, establish that rapport. Don't talk to them. Don't talk down to them as if you're trying to belittle them, but then don't try to throw all this medical jargon and this terminology and these words where you want to sound so educated. Meet them where they are. My nurses laugh at me because I am the most, I'm not going to say unprofessional, but I'm just me. And I'll be like, girl, what's wrong with you?
I get
what
it.
Are you doing? What you doing? I keep it real. But then they come to me and they tell me when things are going on. I had a client sit and tell a nurse, I hadn't been drinking. All I had was this, that, and the other yesterday. I go down in the office and I look at him. I said, what did you just finish this morning? What do you mean? I said, well, for one, your eyes are glossy and I smell the hint of Hennessy on your breath. Miss Carla, well, exactly. I said, and also, what else were you smoking? I said, because you tried to mask it with that cheap cologne, but I still smell that marijuana. You have to keep it real with them, and I call them out. But I want you to know I'm here to help you. I don't expect you to come from inpatient of being inpatient 28 days and feel like you're done. Recovery is not a 28-day program. It is not a 14-day program. It's not a 3-week program. It is lifelong. Yes, you may be clean from the substances, but now you need to learn how to live again. And that requires seeing your counselor, going to classes, doing AA, changing people, places, situations. That's how you get your true deliverance. And then I tell them, you're gonna have to bring in some Jesus. You're gonna have to do some pray. The
That's
knees gonna
right.
have to get ashy. I just keep it real.
We're
Ebonics
all ears,
explained or
Carla.
whatever.
We're all
I be
ears.
ain't and ears and it is
Yeah.
what it is. I'm gonna keep it real with them because they need to know I'm working from here, and
Yeah.
so I tell them when you say, oh, I'm praying every day and I'm praying and I'm praying and God's not delivering me yet. I said, well, are you listening also? Are you listening to him? Are you following the advice that he's giving you? Because
Yeah.
with deliverance comes obedience. You got to obey. You can't just
Sure.
go from this point to that point. You got to put a little you in it. You got to work. I said, and that
Mhm.
also requires sacrifice. We don't want to
Yeah.
sacrifice. We just want to
Yeah.
say, Lord, help me. And you open your eyes and it's done. That's not
You
the way
got
it
to go
works.
through the tough spots. And that's
Yes.
what
And
we
I
were
tell
talking
them,
about with the medication.
mhm,
It's a helper. It's not an answer.
nope.
It's not a life-changing thing. It's a
Mhm.
helper to help you change your life.
Because I tell them I'll give you I'll throw a medication out there for everyone. Anyone that suffers from addiction from maybe painkillers, there's a medication out there called Subutex. I'll just use that one for example. That's used to help you not have withdrawals from when that medication is not in your body because you become addicted. As long as
Mm.
I'm giving you that Subutex and you're taking it, then I'm masking those symptoms. But then, if that's all you're doing and you're not doing any kind of therapy to learn how to cope without that in your life, then if I take the Subutex away, you're going to be right back where you started. So that's why medication is a small component. I know some healthcare providers are like, I can't believe you say that.
I
You say
know.
medication
Mm.
is a small. It is a small component. That's why I
Mhm.
sit in we were required to take psychotherapy classes and
Yes.
hours. And I
Mhm.
commended my university for doing that because I need to know what you're talking about with them when you're in session. I need to know that I don't just need to increase their anxiety medicine because they're dealing with a normal stressor. No, you need to work through those coping skills and use those different analogies, dear man, and those different things
Mhm.
that your counselor has told you to do, deep breathing, mindfulness, all those sorts of things. I need you to use the skills your counselor has equipped you with. You don't need that medication. Some things you just really need to cope once you've gotten to a certain place. Some
Mhm.
Okay.
people may need to increase, it just depends, but there is work to do. And that's why I tell them medication is a small component. It's that therapy that changes you and changes that stinking thinking, the way you
Yeah.
Mhm.
think, the way you act, the way you move. You have to
Yeah.
transform
You're
all of
using
that.
all the DBT knowledge. You got all the
And
DBT
I took
interventions.
but I took the class. I took
Yeah.
CEUs because I want to know what you're doing so that I'm not making them degress, but instead progress. So I feel
Yeah.
like a lot of healthcare providers, if you are a nurse practitioner, a psychiatrist, whatever, learn the skills and learn the things your therapists are doing. Talk to them, have staffing with them so that we can work on one accord. Because if you're telling them one thing and then I'm just telling them, oh, I'll just add some extra medication, we're not helping them
Right.
truly
Right.
recover. So,
Mhm.
I think one of the most profound things you guys have said tonight is that medicine is a helper and not like the answer.
mhm.
It's a
Because
short-term answer.
it
It's
is,
like, hell yeah, short-term answer.
yeah, like it's not all that you need, right?
Mhm.
Because again, thinking about stigmas and thinking about um, getting started on the process, some of us um, we don't like medicine, but yet we don't realize that that is a part of it. It's not everything. Um, Now, can I ask a question? And if it goes outside of what you can publicly say, and that's perfectly fine. But for people who have addictive personalities or
Mhm.
um, who have fear of taking medicine
Mhm.
because they may get addicted, how can we help those people who need help but are afraid of some potential setback?
Well, I will say too, with a lot of the medications now, there are so many different alternatives that you can give. We'll take
Mhm.
anxiety, for example. Everybody wanted to be treated with a benzodiazepine for anxiety. And of course, we know those are habit forming. You don't want to give someone with an addiction that, with any type of addiction, that because there is a high chance that they will become addicted. You have other medications out there now that don't have those addictive qualities that can treat and that can help. But again, it goes back to adding those medications and just that basic, what Lakeisha provides, that therapy,
Awesome.
those coping skills.
And so we look at the stages of change, and what you're speaking of are people who are, probably not even in pre-contemplation. So there's pre-contemplation, contemplation, planning, action, and maintenance. So if they're in the pre-contemplation, I want to change my life, but medication, I'm afraid of it. What I start off with them is basically saying what's the barriers, what's the concern, what's the real concern, and
Okay.
what is your goal. You don't have to you don't have to take it now. See the nurse practitioner, see the doctor, see what they say. There's options.
Mhm.
But if they are, because they can have co-occurring mental illness along with their substance abuse or alcohol abuse or addictive personalities. They can have depression, anxiety, as Carla said. They can have OCD. They can have trauma, PT. They can have many other. They can have medical issues as well that could complicate things. So I'm like Carla. I'm probably not so technical in therapy, like probably we should be or whatever, but the world is changing so much. Clients don't want that anymore. They don't
Right.
want you to just sit there and say, tell me more. I mean, I use that phrase,
Right.
as a catch-all when you're first trying to get someone to talk, but find ways to really reach them and give them a space to talk to you about what the real concern is. And sometimes you'll be surprised that they're really okay with taking the medication. It's just something they've heard, and
Yeah.
not wanting to be addicted to it. And I don't lie. I will say there are
Mhm.
side effects, but right now you have to get to that point. Man,
Right.
that's much easier to deal with. But right now you're still in pre-contemplation and you're thinking
Mhm.
about the maintenance phase. So let's get you on the wheel and get you started first.
Mhm.
And it's about building a trusting relationship. So if my clients um, usually, they look for me, and my husband can tell you, they'll call all the time, which is a good thing. Um,
Mhm.
uh, but when it comes down to getting them to trust you, trust your opinion and trust building that relationship, that client counselor or the client practitioner relationship, again, that's why you want to have someone who's licensed, because Carla has that knowledge of that medication.
Mhm.
I have the knowledge because I work with people like Carla, and we're gonna work
Right.
together. It came back around too many times. We're gonna work together this time.
True.
To have conversations. Like we're not just we're individual practitioners, but we also talk to different colleagues on a day-to-day about questions that we may have. I'm not new, but I'm still relatively new in the field. I haven't been there 10 years. I've been there about 5, but I've been, out in the community for many, many years. So you know the limitations of yourself, and to trust your practitioner with the information. I tell my clients, write down questions, come back and
Right.
ask. Let's look at it together. Let me
Mhm.
get you the information. Just get the medication, reviewing their symptoms. What I also do is go over their assessments. The assessments don't lie. And then if I feel like they are not being truly forthcoming in their assessments, I will say to them, hey, let's take a look at this, because sometimes it won't present the way in the assessment, the way it presents in their life. And we're going to
Right.
talk about it. So really getting into it, and when someone really has had a deep battle with a addiction or depression, I'm not a medication pusher. I am just focused on getting you some relief so that you can start to think and talk about, approach the daunting issues that are in your head. And I am a firm believer that the medication will help balance you out to get you to a point where you can talk about those harder decisions.
Right. And that's what I tell them. If your judgment is clouded, if you're so sad, hopeless, and depressed where you can't even think straight, you're not getting any sleep, you're not eating, your physical health is suffering, if you're delusional, if you're psychotic, I can't help you until I get you to a level where your insight and your judgment is better, where you can understand why I'm doing what I'm doing for you. So, did she?
Yeah, I'm not sure what
Yeah,
just
that's okay.
happened.
We'll work it out.
Oh, for sure.
Just
Absolutely.
explaining to them, I need to get you to a baseline where you can understand what's going on, so then we can work through that. And that's when you add in, the therapy component. And again, like I tell them, deliverance or getting to a what your level of stability is requires
Hmm.
obedience and sacrifice, and that goes by obedience and sacrifice of taking your medications like you should, attending your appointments. You can take that to from that aspect even to a religious, being consistent with your prayer life,
Sure.
being consistent
Yeah.
with being in that word. If you want it, you back that prayer with word, and you're gonna see some things happen. And I always, before I see every client, I pray, Lord, show me what I need to see. Lord,
Yeah.
give me the words to say to them. This is not about me. This is about him. And through
Hmm.
him, sometimes those clients will share things. I had one shared something that has been coming to our clinic for years, but it's because I know that God gave me the questions to ask and
Yeah.
gave me the demeanor just to sit them in front of me, hold their hands and say, it's okay that you're not okay, but you got to
Yeah.
tell the doctor what's really going on. And I
Hmm.
say that because I really wanted to touch base, and I know Keisha can testify to this. When we were talking back, when you said something about healing,
Hmm.
a lot of times we're not healed from things that we didn't even know messed us up. And when I
Very
say
true.
that, I'm talking about something that I could talk about for days, is
Hmm.
adverse childhood experiences,
Experiences. Hmm.
things that you experienced as a child, those traumas that you think you just suppressed and you learn to cope and deal with, that affects how you deal with people from day to day. That put adverse childhood experiences put you at greater risk for physical illness as well as mental illness. That verbal abuse, physical abuse, living
Absolutely.
in high crime areas. Being honest, I'm a transparent person. I grew
Hmm.
up in the heart of Cedar Grove. There were times that we had
How
drive-bys.
did we not know each other?
Right. But we got to a point where I was immune to it, where I went to go visit my mom. We've moved away since then, but she's still there. We heard a few offset gunshots. I said, Mama, did you hear that? Hear what? They've become immune to it. We've learned to cope. But yet and still, you don't realize living in that flight or flight when you were young from those gunshots
Hmm.
and things affected different levels and put you at risk for certain things. We have to deal with those traumas. And that's why therapy is so important. You got to talk to those things, even at
Yeah.
church hurt. Just being honest. People are
Yes, ma'am.
that's a
That's
topic
a
that,
whole
again,
nother show.
whole nother
Right.
story. But just piggybacking
Mm.
on, trauma is just not just something that happened at home. It could be something
Oh
that
yeah.
happened at church. It'd be something that happened at work. But we have to learn that we have to deal with those things that we suppress, because it affects how you love your husband, how you love your children, how you love your parents, how you interact with people at work. It affects you. Trauma is real.
It is.
Adverse
Yeah.
childhood experiences are real. And if we don't deal with those things, we're just a ticking time bomb.
And
And I
we
just
were talking.
I had to cover that because I'm like, it's
Oh
so
yeah,
important. As
Yeah.
blacks, we
I'm gonna
mask,
piggyback
and
on that.
ooh,
I'm gonna piggyback on that.
we just
Um,
don't deal. We suck it up. You a man. Men don't cry.
Yeah.
Suck it up and deal with it. No, cry. It's okay. It's an
that's
emotion that
right.
God gave you. You just have to learn to regulate it. So yeah.
Absolutely.
Yeah, so I want to just to piggyback on that a little
Mhm.
bit. I really like this because there are so many topics that we definitely can't get to here, and so many
Mhm.
diagnoses that we can't get to here. But
Mhm.
um, the ACE, we call it the ACE score, the ACE, as Carla said, the adverse childhood experiences. It asks
Mhm.
you certain things. Have you experienced, and one of them are trauma, witness trauma, experience firsthand. In simple thing, and this is for children. This is for
Mhm.
children, and it talks about, was there alcohol in your home, or did you have enough food to eat? Were you hit? Did someone hurt you? It goes into details. So when I pass that to a parent, to answer for a child, that's an eye opener for that parent because they're like, no, these things didn't happen. So if I pass it to the child's going to answer 100%
Mhm.
honest about those deep things that we have told them you keep at home.
Mm-hmm.
That's what that assessment asks about. That puts in the reason why I pass it to the parents sometimes, because I want you to know that these things, I'm educating them that these things are hurting your child, has hurt you too as an adult if you
Right.
experience any of those things.
Mhm.
And if any of y'all are looking, want to know what's on it, it's on Google. You can Google the assessment just for your knowledge. Um, but parental, mother and fathers, we often have people who come into therapy because they did not get the love they received. They get the love they wanted to receive from a mother or a father.
Mm-hmm.
The mother or father didn't uh, acknowledge them in the way or validate them in their childhood. They grew up trying to people please because they were seeking love in the wrong places, and it all kind of goes back to mother and father, whether one was there or not there. Children that grew up in foster homes, children that grew
Mhm.
up with parents on drugs or alcohol, they have deep-seated issues that can result into alcoholism or substance abuse, and even children who have lost a parent
Right.
at a young age
Yeah.
um, it's trauma. It's trauma. And so
Mm-hmm.
one thing people, a lot of clients want to, because I do assessments, not even just for clients, I do assessments for other local agencies, are not even aware that that is trauma. Well, my mama died, or my dad died, or my brother died, or that's trauma. So, like Carla was saying, they've seen so much of it that it's not, it's a norm, but we have to
Mhm.
educate them and teach them that that's not normal. That's not healthy.
Mm-hmm.
Living from house to house or family member to family member, that is trauma.
Yeah.
Right.
I think
Uh,
it's really really important that we have clarity about what is and what isn't right, because just because um, I'm used to it doesn't mean that
Right.
it's correct, right? And so there is a question that I wanted to that was posed, and I want to share with everyone so that we can kind of talk about this year. Triggers,
mhm.
triggers that cause reactions and cause
That's a good
changes
one.
in
Mm-hmm.
behavior. Can I get one of you ladies to speak about triggers, and is there a way to kind of handle that? What's the necessary help that can be gained by you know acknowledging your triggers?
I think any stressful situation is a trigger, whether it's on the job, whether it could be divorce, it could be death, it could be change in income, it could be relationship issues. There are several things. Anything that causes your stress to be heightened can be a trigger. But in order to deal with the triggers, you must first identify that you had a trauma. And so if
Mm,
I mean, if you're
mm,
oblivious to knowing that something that you thought, like you said, just because it was something you were exposed to over and over, you just assumed that was the right way. Some of
Mm-hmm.
us weren't raised right and we don't even know it until we get
Oh,
into
mm-hmm.
other households and other homes to know, oh, y'all don't do that. Y'all don't, grandpa
right.
don't sit on the porch and smoke and drink, and that's the thing to do. And when you become 13, you sit beside grandpa and
Yeah.
drink a little bit out of his can too. And that's how the
Mm-hmm.
abuse slowly starts because you're already encouraging it. Or I had a client that
Mhm.
said his grandmother said she took it to take the edge off. And she would give it to him to tell him he needed to take the edge off too. But it wasn't to take the edge off. She was having hallucinations and she was drinking to self medicate. And so she didn't want him to feel like it. So she thought that's what she needed to do with him.
To do.
It
Mm-hmm.
wasn't until he had a psychotic break and was diagnosed with schizophrenia, ended up in addiction, to realize she thought she was helping, but she was making matters worse. So
Wow.
sometimes you don't, it's having to have that self-awareness to know that you even have a trauma. And then once you realize you have a trauma or traumatic situation, then from there you can learn and pinpoint what triggers. I tell them to take journals and write down when certain things affect them, cause them happy, sad, big fluctuations in mood. And then that way you can pinpoint what is triggering you. But again, I say you have to first know you've been traumatized before you can even identify your triggers to even begin
Right.
the healing process.
Okay.
So how I usually define triggers, there's one main, well, the uses in our the way we treat and treatment plans, how we have to identify what the diagnosis is,
Mm-hmm.
and the diagnosis, and we come up with goals, interventions, a plan of action, basically, and outcomes. So the way I define triggers with my client, oh, and sorry, and the second part is in the suicide prevention kind of
Mm-hmm.
crisis situation that we help them identify their triggers, people, places, and things. So how I get them to understand real shortly is there's a situation or an event that causes a reaction. There's a reaction being the behavior in between.
Mm-hmm.
So you're triggered a behavior to the which is a reaction to the situation. Notice how you feel when you're in a situation around certain people or doing certain things, what emotions and feelings come up at that time. That's how you
Mm.
identify, because they know I didn't feel that, I didn't like that. Well, you're triggered, but what are you feeling in that trigger? So you got a situation or event causing a reaction, and then it goes into your skill, whether it's a negative or a positive skill. And as Carla said, there are negative coping skills. And then we help them to replace those negative skills with positive ones. There's the work.
Yeah.
So there's an
That
action
medication
and a
won't
behavior.
fix.
Huh?
Right. Right.
I
Right. Right.
said
Right.
that's what I tell you, that medication won't fix. That's that action, that's that
Right.
work.
There's that action.
That's why therapy is so important.
So when people say, I was triggered, it could be
Mm-hmm.
physical symptoms, you know, heart palpitations, racing heart, same thing, kind of same thing,
Mhm.
sweating, crying, running, fight or flight, fighting, and or whatever you're feeling. That's a physical sensation. People pass out, their legs get weak, or they can um, panic attacks. Some people are triggered. They isolate, they withdraw. They You don't see them as much. Um, they start declining at work. So we look at the functionalities of their life. If it's a work, home, school, are they having difficulty in those areas? And what do you usually do when you feel that way? Then we see some people get really angry, and
Yes.
we see them, lash out, the hurting of the children, the hurting people in
Mm-hmm.
the home. And now we see gun violence,
Yes.
you know. So I'm triggered, and now I got this negative feeling that I don't know what to do with. And now I have a reaction, which is a
Mm-hmm.
negative coping skill. And I need
Mm.
to go, like Carla said, medicine's not going to help there. But you got to get on the stage of change and say, I can't do this in the way. I have to truly decide that this is not helpful for me. And I got to find a positive way and hold myself accountable for that.
Mhm.
That's the hard part. And that's when people kind of taper off and don't come back to therapy, because, you know, we're there to help you along. We're not here to judge. I
Mm-hmm.
tell my clients there's no judgment here. Honestly, this is how I go to therapy every day. No makeup, t-shirt. It's
Mm-hmm.
non-threatening. It's not about what I look like. I tell my
Right.
clients, if you're not feeling good, just don't turn the video on. Get on. I've sat on there. They have get up, take a shower, call somebody, get something to eat. People are fighting life and death situations because
Mm.
something triggered them. People can trigger people.
Mm.
Husbands, wives, children,
Yeah.
mother, father. People get church hurt. Start it over
So.
there. Let's bring it in and throw it back out.
Right.
But
Right.
all of that is a trigger for
Social media.
social media. Yes.
Because there's so much out there, we get consumed and we feel like we take on the weight of everything that's being posted on social media. And I tell people, you have to take breaks and you have to fast from it, because that will put you in a completely different state if you're so consumed. I had to turn off my notifications at one point. I love me
Hmm.
some Timmy Lane, don't get me wrong, but every
But
time it would come on, it's always, and then you just, every time you look around, it's a shooting, it's
it's
this and it's that.
trauma. That's
I had to stop
vicarious
watching.
trauma.
Yes, I had to stop watching the news because I was like, it is taking a toll on my mental health. I can't listen and
Yes.
see this all the time. Not that I don't want to be aware that it's going on, because I do, but I had to limit it because I felt myself just being so consumed with it that it was affecting me. So we have to be careful. Social media can be the best thing in the world, but it can
Yeah.
also be the worst.
Yeah, there's a
It's a big
level of
trigger.
balance
Hmm.
that is needed in order for us to live healthy. Um,
Hmm.
and I think this is a good place here to kind of um, pivot into the last topic, which is suicide.
Hmm.
And we really talked already about ways to kind of identify for those of us who have friends or who have family members um, who have changes in behavior. Like, what is the best way for us to kind of, is there a way to pinpoint somebody who is having suicidal thoughts before it gets to that point? What are some tools that parents who are concerned, about the children or family members, what is the best way that we can help the people that we care about, the people that we love when it comes to this?
I think a lot of times it's, we get so, we were just talking about this at work, even we treat mental illness, but we need to pay more attention to our own clinicians and staff members. And it's those subtle changes. It's
Hmm.
that coworker that used to always be in the break room interacting, who all of a sudden now chooses to eat lunch in their office, and we think, oh well, maybe they just don't want to eat with us anymore and they want to spend their time, just being to themselves and eating lunch. And we kind of make excuses for why people are not doing what they used to do. But that person that may be all of a sudden now, not eating with us or not attending events, or their hygiene, subtle changes in their hygiene, and not
Okay.
caring what they come to work in, not talking as much, just those, just subtle changes. In children, sometimes it's those chronic physical complaints. I know sometimes we think that could be related to depression, but it's sometimes that acting out and those behavior issues because they're looking for attention. And then when they don't get it, then they may begin to self harm. So it's just noticing those subtle pulling away from society, pulling away from everything, just subtle changes, not texting back, and not the friend that you call and you don't hear from them for a couple of days. But in the
Right.
hustle and bustle of our work life, we think, oh, they're just busy. But it may not be that case. They may be, like Keisha said earlier, suffering in silence. So
Yeah.
it's doing those safety checks on those strong friends, on those
Yeah.
strong family members, because those are the
Yeah.
ones that suffer the most and we don't know it. So I think it really is just noticing those subtle changes in appearance, the subtle changes in grooming, eating habits, weight loss. It could even be weight gain. You just have to really put it together, and we have to be more vigilant with paying
Hmm.
attention to people's behaviors, because we're so busy, these days. And before we know it, people have done things and taken their
Right.
life, or attempted to, or
Mhm.
or they cry out for help on Facebook. A lot of times people think, oh, people are
Yes.
crying out and doing that for attention. That's
Yes.
not
They
always
are,
for attention.
but it's
And they,
not
yes,
negative
and they
attention, but they're
assume that they're doing it for the wrong reasons, and they ignore them, and they feel like they're crying wolf. Well, that one time
right.
that you think they're crying wolf, they take their life. So it's just really paying attention and stopping for a second and just paying attention to people's behavior and their attitudes and their changes.
Mhm.
Okay.
In addition to the odd behavior that Carla is speaking of, let's normalize I'm not okay. And I
Mm.
think that's been a takeoff on a lot of social media and
Mhm.
mental health commercials. I'm not okay.
Yeah.
And it's learning what to say when someone says I'm not okay. Because
Yes.
Right.
again, the thing is that we were trained to say, "Oh, I'm okay. Oh, I'm okay. I'm okay," and because we were taught, no one really wants to put their business out there. You don't tell everybody you deal with it. That's not working. Not
Mm-hmm.
working. I'm not okay. Learning what to say when someone says I'm not okay to you. Can't go into it now because we're time limited, but there's resources. If someone
Right.
Yeah.
says they're not okay, you simply say, let's talk, and people will do that. I'm going to call you. Call them. Call them.
Right.
Yeah.
They're probably waiting on you to call. Let's not say I'm gonna pray for you and let that be the prayer. You know, really call them and pray for them. Check
Mm-hmm.
on them
That's so
again
true.
and again and again and again. Yes, you may get worn out, but you're saving a life.
Yeah.
Right.
You're saving
That's
some.
so big on you because those empty promises are sometimes what will push them over the
Yes,
edge
ma'am.
because
Yeah.
everybody says I'm going to check on you, I'm going to do this, but we don't follow through. And that's why I have really learned to try to be consistent with, if I tell someone I'm going to do something, I do it. If I know there's a chance I'm not going to do it, I don't make that promise.
Yeah.
Because
Your
Yeah.
phone
I've been on
call,
the receiving end of that, of someone saying, I'm gonna do this, girl. And then they say, well, I never found the time. And I know how that made me feel. So I
absolutely.
really have started to try to not take on things and make promises that I know I can't keep.
Hmm. Your
Absolutely.
phone call could save that person's life
Right,
because they
right.
could really be saying, well, if she calls, then I'll tell her. If he
Mm-hmm.
Yeah.
calls, then I'll tell her. And
Yeah.
like you said, that could be the thing that makes that person feel like I'm really not worth it.
Mm-hmm.
All of us
Mhm.
have probably said at some point in time, something put you on my heart. My spirit said, reach out to you, and you feel really good that you are doing the work of God and
Mm-hmm.
answering your spirit, your call, you're doing
Yes,
to
Lord.
make that phone call when it crosses your mind. It happens to me
Mm-hmm.
so much, and one or two times I remember not doing it to find out a month later something happened, and I should have. And
Yeah.
then sometimes I'm like, I don't want to bother them. And then when I do it, I'm like, I'm so glad I called. And I'm
Right,
so
Yeah.
glad when they call me. And don't let the other person push you away.
right.
So you may not, because if they're saying to you, I'm okay, don't worry about me, and you feel
Mm-hmm.
like
Yeah.
you're getting on their nerves or something like that,
Yeah.
if you know they're in the middle of a crisis or they're odd or strange behavior, they're
Mm-hmm.
your loved one. That's the time you do kind of get on their nerves by keeping, in touch with them. You know, as Adrian said, y'all better call me.
Absolutely. Absolutely.
So,
Right.
So,
yeah.
um, this is a great conversation. Such a great conversation.
Mm-hmm.
I do want to address a question that Elder Adrian posed earlier regarding contacting law enforcement or mental health emergency. So we've seen in the news a lot of times how um, someone's having a mental health crisis and they call 911, and sometimes law enforcement hasn't responded in the proper way. Um, how can we, um, is there a way that we can trust or call the right people to help in mental health crises? Like, do we have to call 911? Is there other resources that we can use in those emergency type situations?
I will say this before. I know that our law enforcement officers are currently, they're in the process. I'm sorry, y'all. If y'all hear my big grandbaby in the background, he just came in. I know they're currently in the process of making law enforcement. They're in the process of making law enforcement learn and are trained to know how to respond to mental health crises.
Good,
At one
good, good,
point,
good.
they had like a task force that
Mhm.
got dissolved. I don't know why, for whatever reasons, but they even used to wear goggles and headphones that would make them feel how someone feels, that hallucinates auditory as well as visual. And it was a grant. They're trying to get that grant back up and going so that they can see how it feels for someone who is walking through the street and they're actively psychotic. I tell a lot of my mental health clients, their family members, if you have to call 911, immediately tell them, add to the notes that this is a mental health patient. Add to the note that they are suffering from depression. Add to the note they are suffering from schizophrenia. So I need you to dispatch to whatever officer is coming to this call. I need 911 to dispatch this person suffers from mental illness. And also, too, let them know if you have a family member that's having issues that suffers from autism. Some of them are nonverbal and they don't
Yes.
know how to respond.
Right.
And we've
Right.
had bad situations with
Right.
autistic adults and autistic children that the police had to be called out and they don't know how to communicate and they thought that they were aggressive. So I tell them, if you're at risk to hurt yourself or hurt others, you don't always have to call 911. You can call the coroner and you can get the coroner to come out and do an emergency certificate to get them where they need to be. If you can get them to their doctor can do what's called PEC, and that's, do a physician's emergency certificate. If they're voluntary and willing and you don't want to go through 911 and they have insurance, Medicaid or Medicare or private, and they don't want to risk the sirens and the police coming out, you can call Ballantine Ambulance Service. And if they're willing to go, they'll transport them. So that's just other resources and avenues, because it is frightening if you have someone that's psychotic and the police pull up with their lights going, the sirens from this, that, and that. It can completely trigger them and cause them to be even more psychotic, especially if they're paranoid. And we can add into that factor of substance abuse. If there's substance-induced psychosis, that's a whole nother evil, and those are things where you just want to make sure they know. But I tell them, if you're going to call 911, please tell the dispatcher who answers, please dispatch to law enforcement that this person suffers from mental illness, so they can go in at least knowing that, because it can end ugly and it is scary. And a lot of our patients' family members don't want to call because they're afraid they're going to come out and they're going to shoot them.
Yes. To add, Carla, thank you. That's great. That's exactly more than what I would have said, because you educated me on some things with that too. There's also the 988 suicide and crisis lifeline that's specific. So if you know that it's a suicide, and they have different response mechanisms trained differently to the situation. And also, if you know, if there's most therapists will have or doctors, nurse practitioners, they're probably on call. They'll do a welfare check really, really quickly, more so, and probably a little bit more cautiously if the licensed person calls. Because I've been on the phone while they drive and while they get there. So I'm on the phone with the client, on the phone with, Shreveport PD, and talking to them both, to kind of mitigate the situation a little bit. If you do know a healthcare provider that offers that kind of, because I know they're also developing mobile crisis units. So when that's established, it'll be handled a little bit better. So if you do have that person is willing to make that call and be on there with that client, that's probably me just going a little bit, extra mile, but I'll take the call middle of the night, and I've gotten up with the middle of the night. If you're a person that's not licensed or anything, you can also ask the person, hey, I'll go with you. I'll come get you and I'll take you. Try to sit with them, go over there, calm them. And if you don't know what to do, then you can call and talk to a professional that can help you find the right words to get the person to, as Carla said, willingly go to Brentwood, to Oceans, to Willis Knighton. They have an intake center. There's multiple places, and I know a lot of people feel more comfortable with going to Willis Knighton because it's a hospital, and they may just hold them for a couple of days and may not transport them exactly to, a psychiatric facility. So you just say, hey, we're just going to go to Willis Knighton just to get you checked out, to get you calmed down. Now, once they're there, the doctors can take care of the next step.
Awesome. Okay. Well, listen, again, thank you guys so much for today's and tonight's conversation. I do want to just post here some resources that are available for you guys to use. We'll post some of these in the chat as well to ensure that that you can have them. So, of course, 988 is the number for the suicide prevention um, as well. So, um, we're just
Brian,
about.
I'm sorry.
Oh,
One
yes,
last
ma'am. Go
thing
ahead.
about the SAMHSA. They
Yes, ma'am.
offer a free 2 day applied suicide intervention skills training. Louisiana Association of Compulsive Gambling, LACG, they actually manage, it's don't seem like they would go together, but I used to work there. The suicide line for multiple states are handled right here in Shreveport downtown. So most of the calls from several states, they have a contract go into downtown and they manage those lines. But they offer a free 2 day applied suicide intervention skills training called Assist that you can
Mm,
take if this is an area of specialty that you want to get free training
awesome. That is certainly something that I think we need to take advantage of at
Mhm.
Greater
in.
Everywhere. Sure.
Absolutely. Absolutely.
Um, wow. Okay. Excellent. Well, this has been a tremendous conversation tonight. I do pray that something that has been said tonight has helped, has blessed um, you watching tonight, and again, for anyone who who needs some assistance, um, is there a contact or a resource personally for you two ladies that you are able to share if they're needing to set up some type of an appointment with you? Can you release or share that information at this time?
Sure. I work at Shreveport Behavior Health. You can look us up. I think it's Northwest Louisiana. So it's nwlhsd.org. And you can click on there. And from there, you can even send an email message or you can call and ask to speak to me, and we can get you started on the intake process. That is, more than I'm Carla Renee on Facebook. If you send an inbox saying I need help, now depending on what type of help you say you need depends on if I'm gonna send out for a welfare check. I'm just putting that disclaimer out there because I'm a healthcare
Yes,
professional under oath.
absolutely.
You inbox me about being suicidal, or I'd rather you call
We're going to
me.
save your life,
Right,
basically.
right. But if you just don't know where to go and need some resources, and maybe it's a service that I can't provide, or maybe you're looking for something else, then feel free. I'm always my pretty much everything on my page is public. So where I work, if you pull up my name and you click on it from there, you can get our website and there's all the information, that's there and that's available. And like I said, if you need a resource for something else that our facility may not provide, if I don't know, I will help you find out.
And for
Excellent.
me, I have a dedicated client line. You can call me. Yeah, I'm sorry, I'm getting over a head cold if I sound like my words are muffled together.
Mhm.
Dedicated client line is 318-405-1382, 405-1382. If it's an emergency, please call 911, or I will respond in the same way Miss Carla suggested. That's not to scare you. That's just
Right.
that you know that we're serious
Mhm.
about, if you do call, we're gonna listen. We're gonna say, are you okay? And then we're gonna have follow-up questions.
Mhm.
Or you can reach me on Facebook or Instagram, any of the social media platforms, Lakeisha MD, LPC, on Instagram. No, I'm not a doctor. MD is just my last name, the initials of my last name. Lakeisha
Not
MD,
yet.
LPC. Not speak. um, and then on Facebook, Lakeisha Mosley Davis, LPC.
Awesome. Awesome. So, again, ladies, thank you so much for accepting the invitation. Your information tonight has been invaluable. So, on behalf of Greater Everywhere, our young adult ministry, our pastor, Keswick Durden, First Lady Shantae Durden. Thank you guys so much. Thank you everyone for watching this broadcast. If you want to watch it again, it's available on our YouTube page and it'll be available on our Facebook page as well. I do hope that you all enjoy the rest of your evening, and we'll see you next time. Bye,
All
y'all.
right.
Thank you. Bye bye.